Well, it's the start of a new year, and many of us are setting health and fitness goals. One of the most well-known health trends is fasting, a practice that has been around for years, but is becoming popular with Bermuda residents. Eloisa Mayers tells us more.
Naturopathic doctor Amani says up to 100 local clients of North Shore Medical are actively fasting. Many are using the intermittent fasting method, where you abstain from foods but not liquids for up to 16 hours a day. She says clinical trials show it's a beneficial practice in helping some patients manage type 2 diabetes.
Just this weekend, I was sharing with my colleagues that one of the first randomized clinical trials has actually come out about intermittent fasting and blood glucose control and the reduction of diabetes. So now that can actually be added to the scientific literature for the benefits of intermittent fasting.
Fasting is controversial and it can be risky for some. However, a study published by JAMA Internal Medicine shows people can lose weight and treat hypertension by eating between 7 a.m. and 3 p.m.
So intermittent fasting, yes, it is science-backed. It is proven to lower blood sugar. How does it help with weight control? In a number of ways. Again, it helps to reduce the calorie intake simply by not eating all day long. It also forces to use up its energy as opposed to storing energy, which is what body fat accumulation is, stored excess energy.
75% of Bermuda residents are obese or overweight, and 50% suffer from a chronic condition like type 2 diabetes or kidney disease. Dr. Flood says while fasting is not a magic remedy, some find it helps energy, mood, and digestion.
Do you think it's just another diet trend, or is it something really that could help us get slim and healthier?
It's a helpful part of an overall health improvement program. By itself, it's not going to solve any problem, because if you use your eating window to scarf down all sorts of sugars and carbs, then you're going to be defeating the purpose. So we're not really attributing it to intermittent fasting just because, but when intermittent fasting is done appropriately, then you get the health benefit.
Safety comes first, so it's essential to speak with your doctor before practicing a fast. Anyone who is elderly, under 18, breastfeeding, or pregnant should not fast. While she is supportive of those who choose to do so, Dr. Flood says as a community, we can make more sustainable changes by paying closer attention to what's on our plate.
I am advocating for an overall healthier Bermuda diet. We have to reduce the sugar intake and the excess carbs. The typical Bermudian party meal is laden with carbs and sugar. And as long as we continue to look at that as a standard of diet, we're going to suffer these ill health effects.
The majority of doctors recommend a balanced whole foods diet with enough grains, fruits, vegetables, and lean or plant-based proteins. Getting enough sleep and reducing stress are tools that help with long-term health and weight management. Eloisa Mayers for Bermuda Broadcasting News.
The latest figures from Operation Vega, a police